something that's really important to us because women's intimate health is one of the reasons we founded a clinic solely dedicated to the treatment of pelvic floor disorders, specifically using non-invasive techniques and solutions. So while the Viveve is our favorite treatment, it's just one of the many tools we use to help our clients overcome conditions like incontinence, pelvic pain, and sexual dysfunction. So let's get started by talking about what conditions the Viveve can treat. If you have stress urinary incontinence, which means that you leak urine when you sneeze, cough, laugh, or exercise, if you find that you're wearing liners or pads just because, or maybe you've even noticed that simple things like just changing positions, or when you get that sensation that you have to go to the bathroom is causing leaks. Maybe you've noticed a decreased sensation, friction, arousal, or responsiveness during intercourse, or if you're experiencing vaginal dryness that's leading to discomfort. Viveve is the non-surgical drug-free solution that you've been looking for. And really, it's the solution that we were looking for. So in our experience of treating hundreds of women with these symptoms, and for Melissa and I battling our own pelvic floor conditions, you know, we came to know and understand intimately what women need. So just to share my story quickly, in my early 40s, I started to experience leaking, and soon afterwards, I was having vaginal dryness. So you might be surprised that really so young, I started to experience some of those menopausal symptoms, but a lot of women don't know that perimenopausal or menopausal symptoms can start years before you actually stop having periods. So before we talk about the treatment and how it works and who's a good candidate, I'd like to do just a quick poll and see what symptoms most of you are experiencing or that you're concerned about. So we'll give you like 5 to 10 seconds to answer these quick survey questions. So just if you have experienced, you can select more than one of these. If you've experienced leaking with coughing or sneezing or laughing, dryness or lack of lubrication, decreased sensation, maybe a feeling of looseness during intercourse, or even like tampons slipping. We have some clients that describe they have to use 2 tampons even just to get them to stay in place. So, all right, we'll wait for you to do that. All right, let's see if we can take a look at our results. Excellent. So it does, you know, as we've expected. Again, these poll results, we have a couple of other polls that are completely anonymous, but about 80% of people that are listening tonight are experiencing incontinence and, of course, dryness, lack of sensation. So this is typically what we see in our clinic as well. So, you know, we wanted to let you know that really you're not alone. 50% of women experience bladder leaks and 40% of women suffer from sexual dysfunction. And really for women over 50, this is more like 60%. So, and there's one study that showed that 25% of female collegiate athletes experience stress urinary incontinence. So it really is a common occurrence, but you might be thinking, so why do we care? Or why are we even paying attention to this? If it's common, it's obviously something we should just expect as women. But really, you know, first of all, it's embarrassing and it's life limiting. A lot of our clients aren't engaging in activities that they prefer. They're not doing things with their children. They have concerns about intimacy. And so that's one reason we care. And also we want people to understand that just because it's common doesn't mean it's normal. I think that there is this unspoken rule or thought or idea or belief that this is just something we're going to have to endure or live with, but that's not accurate. There are things that can be done. So, you know, one of the other reasons that we're concerned, Melissa and I both have aging mothers. And research shows that incontinence is the #1 reason that older people are institutionalized or end up having to live in a nursing home. So incontinence, we know that incontinence only gets worse if it's not treated. If women aren't given the right tools, the right education, and the right interventions to stop the leaks. So, so it matters. It makes a difference in your life now and in the future. And I think one of the things that kind of really burns me up, Melissa and I talk about this all the time, or gets me upset, is that no one would expect men to just live with wearing liners, pads, or some kind of special underwear. they would consider this a national crisis, with full resources of the CDC would be employed if half the men out there were peeing themselves on a daily basis. I mean, come on. So we are passionate about women's health and providing solutions that allow women to be active and live worry-free, because as wives and mothers and business owners, I mean, we all have plenty to worry about. So. Okay, so let's talk a little bit about what the Viveve system is exactly. Viveve is an energy delivering device that heats deep tissues of the vaginal wall, and it stimulates collagenesis, or the production of collagen. So what makes Viveve unique is that it also has patented cryogen cooling technology. So this allows Viveve to reach deeper layers of the tissue without causing discomfort or disruption of the surface layers. Just a reminder that collagen is that connective tissue that provides tone and structure to our skin and our muscles. It's also what gives our skin that youthful, plump appearance and vitality, and it helps to keep our internal organs in place as well. So it's important to think about collagen when it comes to matters of intimate health, because what we see happening on the outside of our body as we age or experience trauma, for example, the stretch marks you see from pregnancy or scar tissue from a cut or a tear, it's also occurring on the inside of our bodies and in the tissues of the vaginal wall. Vaginal laxity is the primary reason that the Viveve was developed. And it matters not just for sexual satisfaction for us and for our partners, but the loss of collagen or overstretching of those collagen fibers that don't reorganize themselves can lead to incontinence and also pelvic organ prolapse. So just so we can get a sense about how many people have concerns about or have thought about vaginal laxity, we want to do again a quick anonymous poll and just have you rate the amount of vaginal laxity you think that you might be currently experiencing, or if this is ever a problem that's occurred to you. So again, how would you rate your current level of vaginal laxity? We'll wait here just a minute, and we'll check our results. All right, can we get the results of that? Let's see. All right, so most people are experiencing slightly or moderately loose tissue. And again, that's something to be aware of, because as we age and the collagen changes and breaking down, it is something that can become an increased problem over time. So, all right. So this slide just compares the depth of tissue stimulation that the Viveve is able to achieve because of the cryogen cooling versus other vaginal rejuvenation treatments that are attempting to achieve the same result. So, however, because these other treatments can't cool the superficial tissues at the same time, these devices require multiple treatments over an extended period of time. The Viveve is able to deliver such a high dose of energy that it only requires one single 45-minute session to achieve the same or even better results. Also, the great thing about the energy delivered by the Viveve is that it passes through all layers of the vaginal tissue, and it stimulates stem cell activity, so the superficial layers are reinvigorated as well. And as a result, women experience better lubrication and rejuvenation of maybe thinning tissues, which helps with comfort, sensation, and satisfaction. So. All right, so what can you expect during a Viveve treatment? The Viveve is an in-office procedure. It's comfortable, it's discreet, and as we mentioned, it takes about 45 minutes. There's no medications, anesthesia, or numbing cream required pre or post-treatment. It's just a small probe about the size and shape of a toothbrush, without the bristles, of course, ladies. We would never do that. And it's inserted just inside the vaginal opening. The Viveve is rotated about 5 degrees at a time while a short pulse of energy is delivered to the tissue. This probe does not have to be in continuous motion or moved in and out repeatedly. We make two full rotations over time, with the probe inserted approximately just 3 centimeters to 5 centimeters deep. So Patients report feeling a sensation of warmth and cooling during the treatment. I know I noticed afterwards that my urine was a little warm when I first went to the bathroom after the procedure, but really that was it. I mean, you're able to return to your normal routines and activities immediately following the procedure. There's no downtime, no recovery required. And unique to Optimal Living, because we are a pelvic health center, your first appointment is going to include a thorough review of all of your pelvic symptoms. We're going to do a quick observation of skin integrity and assess for signs of pelvic organ prolapse. In addition, we encourage our patients or our clients to take advantage of our therapy programs that include biofeedback, instruction in a home exercise program, and intensive education about your diagnosis or pelvic health concerns. So by providing therapy as an adjunct to Viveve, we found that our patients have maintained their results far longer than what might be expected with just the Viveve treatment alone. All right, so what results should I expect? You know, again, the Viveve is approved in over 50 countries for these treatments. Studies have proven the safety and efficacy of the Viveve treatment. Women typically notice results in the first 30 days, and the full effect of the treatment will be realized over a 90-day period of time. So just remember, this is an energy device that stimulates your body's ability to produce collagen. So just like you didn't lose collagen overnight, it can take a little bit of time for your body to regenerate it. So one question we get is how long can we expect the results to be maintained? So the longitudinal studies that have been published have only tracked results for up to a year. And what they found is that 75% of women report having continued symptoms at the same level at their 90-day high. But just like energy-based treatments, laser or radio frequency that we might get on our face, you know, vaginal energy treatments are going to have a shelf life. We're all battling the collagen depletion that naturally occurs as we age, but so that's just something to keep in mind. But at Optimal Living so far, our patients have maintained their results well past the 1-year mark because of the extra therapies and services and education that we provide. So. All right, so are you a good candidate? Am I a good candidate for the treatment of Viveve? So let's do a quick survey really quick, ask some questions of you, and I'll be able to answer that. So just thinking back, have your symptoms that you're currently experiencing ever affected your ability to engage or be intimate, or mental or physical arousal? Has it affected your confidence, your interest, or even your ability to do things that you normally would love to do, like exercise or play with your kids? And have your symptoms ever affected maybe your partner's experience during intimacy? So again, the results are anonymous. We'll give you a couple seconds here to fill that out. All right, let's take a look. You can choose multiple answers. Hopefully we get the good results. So yeah, I mean, 100%. That's what we're talking about, ladies. I mean, I don't love seeing that answer, but I love seeing the confirmation that that's why we are so passionate about providing pelvic health treatments to women, because we know that you're limiting the participation in activities that you love, that you prefer, that you want to do because you're experiencing these symptoms. So that's what we care about. All right, let's look at the next slide here. Okay, so some frequently asked questions. Again, how is it different? Am I a good candidate? We've addressed that. Why can't I achieve the same results with Kegels or exercises? So exercise can improve blood flow. It's going to strengthen the muscles, but it doesn't reorganize or prevent the loss of collagen. So even the most physically fit person can experience these symptoms. It's not always a matter of strength. And especially as our hormones change with pregnancy and with menopause, our skin and our muscle integrity is compromised. So, you know, we get another question as well. How much does it cost? The Viveve treatment is an elective procedure. It does retail for $3,000, which, you know, in reality is much less expensive than some of the other treatment options our clients have been offered, such as surgery. It's less expensive than other vaginal rejuvenation treatments because Viveve only requires one session. But for people watching this presentation live or in the future, we want you to know that we are giving viewers a 25% discount if this procedure is scheduled at the time of your complimentary consultation. As well, we do have a variety of financing options available. And I would encourage any woman watching who thinks this is too expensive to consider the cost of not getting treatment. There have been studies that look at how much women spend on average just maintaining or managing the symptoms of incontinence. And on average, we spend about $2,000 a year. I mean, I'm always joking, you know, you talk about a pink tax, you know, how many guys are having to buy products to manage this, right? And you can't really put a value on how it affects our quality of life or our confidence. As women, I think we don't often invest in ourselves, but our happiness and our health is equally as important. Your family deserves the very best version of you that you can give them. And you know, we talk a lot, we spend a lot on our hair, we spend a lot on our faces. I mean, this is important. And what I appreciate is there are a lot of stars and famous people that have been bringing attention to these types of treatments and how important it is for us to pay attention to this as women. So just a reminder that we do have a variety of solutions from very entry level to high level technology like the Viveve. So if this isn't the answer for you for whatever reason, we can still offer help. We promote the Viveve, we educate our clients and patients about the Viveve because it's fast and it does produce long-term results, and our patients experience improvement without the commitment to intensive home programs and therapies. But really, it is just one solution in our arsenal of tools in the battle against intimate health limitations for women. So. All right, just some warnings and precautions, you know, probably mostly obvious to you, but just to make sure we cover it. It's not for women who are currently pregnant or nursing. It's not that there's a problem with nursing in particular, but we just want to make sure that your hormones have kind of gotten back to normal before we do this treatment. It's not for women currently undergoing radiation or chemotherapy. If you have open lesions from an STD, if you have a large metal implant, it won't preclude you from getting this treatment, but we do kind of alter and are conscientious about how we deliver the energy, so we just need prior knowledge. It is not an option if you have a pacemaker or an implanted defibrillator. If you have a chronic vaginal medical condition, we do have different types of therapies and treatments to resolve issues like dyspareunia or vaginismus, but we would want to resolve that first before we looked at the Viveve as a treatment. And of course, if you have any allergy to any components of the Viveve treatment. So, you know, what are our patients saying? We have had so many patients tell us that we've changed their lives, and that's probably as hard of work as it can be to run a business that motivates us the most. Why we're still here today is because we know we're making a difference in the lives of women. You can see a few video posts and testimonies on our website. You know, I personally can attest to the effectiveness of this treatment. And of course, that's one of the litmus tests of any treatment or a solution that we offer at Optimal Living Therapy. Would we use it on ourselves, or would we recommend it to our family members? And with the Viveve, the answer is a resounding yes. So without a doubt, I'm personally thankful for this technology because it's made such a difference in my day-to-day life and has affected my confidence and kind of my freedom in the bedroom, if we're really being frank. Okay, so just quick notes. Obviously, results are going to vary. Viveve is just one aspect of intimate health and satisfaction. That's one of the reasons that we provide adjunct therapies and opportunities for touch-up treatments. Individual factors such as the number of births, age at the time of treatment, the length of symptoms can affect the outcome. But again, we are 100% invested in our patients getting relief from pelvic floor dysfunction and experiencing an optimal state of living. So we give every effort, every advantage, every intervention to make sure that our patients experience success. So. All right, so that concludes kind of all the information. I know that was quick. I know I talked through that really quick. We wanted to be mindful and respectful of your time. If you didn't get all of that information, if I talked a little bit too fast, you will get a link. So watch your inbox for a follow-up email that's going to include our exclusive offer for the next 45 days, a link to the video, and also a survey to give us some feedback about how well this webinar was delivered and if it helped you. Just a reminder, our consultations are complimentary, so you can schedule an appointment right away, and our goal is to help you achieve an optimal state of living.
Okay, and we also have some questions coming in, and we want to be sure to answer those for you. So the first question we have is, does this interfere with a bladder sling that is 15 years old?
Oh, that's a good question. No, actually, there isn't any because of the type of material that's used in the bladder sling, the mesh. There isn't any necessarily contraindication specifically to that. But again, we do a quick exam. We're going to take a thorough history. But no, we have had patients that have had, I don't want to say failed bladder sling surgeries, but and I won't get into that the FDA has pulled a lot of those off of the market, but maybe the sling isn't providing them with the long-term results that they wanted. So no, to answer that briefly, Melissa's going to have to cut me off. Man, I'm a chatty person. No, we can help.
That's perfect. Okay, and we'll give you guys just a little bit more time. If you have any questions, go ahead and type it in the chat, and we will be happy to answer that for you. So we'll give you a couple of minutes to do that. Okay, another one is there risk of injury for this treatment?
Okay, so that's a great question as well. There have been no documented adverse effects of this treatment thus far, but I would be remiss if I didn't remind you that we are delivering energy. One of the beautiful things about this specific Viveve treatment is the cryogen cooling. So the fact that we're able to deliver heat energy, kind of what happens with lasers, but we also can cool the tissue at the same time. It prevents ablation or any type of negative treatment. So to date, no adverse treatments have been reported or adverse reactions have been reported.
Okay, next question. How long is the complimentary meeting?
That's a great question. I like to say we book a 20-minute appointment, but yeah, we've never really been, we meet with people, we're here to help you solve whatever problems you have, but we book for 20 minutes for the complimentary consultation. But we'll take extra time with people if they need it.
Next question, how long have we been in business?
We've been in business since 2015, and we have been in our current location since 2017. But we've been practitioners. Well, gosh, you shouldn't ask a lady her age. Melissa's a lot younger than I am, but we've been in practice for quite a period of time, but at this location in 2017.
Yeah, you should tell them. I've been in practice for 11 years and you've been in practice for over 20 years. So
yeah, and not 20 plus years.
Okay.
That's all I'm saying. I'm having a magical birthday this year, ladies. Ugh.
Number 50.
It's my last one, actually. I'm having my last birthday this year. Oh, I mean, I don't mean I'm dying, I'm just saying, you know.
All right, we'll give you guys another minute here in case you have any other burning questions. But again, we do offer those consultations, so. Okay, looks like, all right. How soon after treatment can you engage in sexual relations?
That night, technically, in theory. We usually tell people to wait 48 hours, but there really is no limitation on that. So,
yeah, because it's non-ablative and it doesn't damage the tissue, you can resume all activities pretty much immediately. Let's see. Oh, this is a nice comment. Thank you. It says, thank you so much for this. It has been super helpful. That's perfect. Thank you so much. That's kind. calling to make an appointment. Great presentation, ladies. Thank you guys. We really appreciate it. We were very nervous, to be honest. So thank you.
Yeah, you just want to make sure you want to be mindful of everybody's time and get as much information in as you can. But we know the best way to really explore this treatment option and what the best option is for you is to meet you and learn about your personal history and what your goals are. So we're here.
Another question. No, that's okay. Another question. Does this work for urge incontinence?
You know what? It actually does. And we have some other, again, because we combine our therapy, we recommend that people take advantage of our therapy program as well. We have some other technologies that we use for urge incontinence, but I've had urge incontinence my whole life, even as a young child. And so it wasn't until my early 40s that I started getting leaking that all of a sudden, now my urge incontinence was a problem. But yes, this does help as well with urge incontinence. And then we give you all of the tips and strategies so you can understand exactly what's causing that. And there are other technologies that you can utilize that will help to control or lessen those urge symptoms that you're experiencing as well. So great question.
Okay, a few more comments. Great job. Thanks for reaching out to us. We appreciate this. So yeah, thank you guys. Yeah, thank you for all the positive comments that you have left. And then we have some more questions here. How successful is this for organ prolapse?
Okay, so that's a great question as well. We've had really good success with mild to moderate organ prolapse. So it depends, are you talking about cystocele, more cystocele and uterine prolapse? It helps a little bit with rectal cell, but that's where a lot of education that we provide in helping people explore nutrition, diet, and good bowel and bladder habits helps with rectal cell. So if a grade 1, grade 2, even some of our grade 3 patients, we had one patient in particular that was really dependent on a pessary. And I don't know how much you guys read research. That's like one of my favorite side hobbies. I've got to get a new hobby. But they were talking about how pessaries were actually leading to greater risk of constipation. And then with constipation, you're straining and you're getting weakness of the pelvic floor. So it's like this weird cycle. But she was dependent on a pessary and was able to not use the pessary and was super excited. So she's actually one of the videos on our website, video testimonies. I think you'd be excited to hear what she had to say.
Okay. Few more thank yous. Thank you guys for being on here.
Absolutely.
We're appreciative. And I'll give it another minute just in case. Don't be shy. If you have questions, we're here to answer them for you. Another great job. Another thank you.
All right, it looks like we might have answered all of the questions so far for tonight. Again, we're here for you. So ladies, we're starting a revolution. This is not, it's hashtag not my new normal. You do not have to live with this. Surgery, medications, injections are not your only options. Hashtag say goodbye to SUI. What do we say? Hashtag pitch the pads, hashtag lose the liners, hashtag ditch the diapers. I mean, we're here. Yeah, we're not going to settle for less than optimal results, and there are other options for you. So please reach out. We're here to help answer any questions. So thank you so much for joining us tonight. We're gonna wait. Oh, we got another one coming.
We got one more.
Oh, one more question coming in.
Okay, let's see. She said, I began having incontinence at age 60.
Mhm.
and it comes and goes.
Yeah.
Will this work for that?
It will, along with the therapies. I would want to do, if it's coming and going, I would really want to spend a little more time kind of investigating, when is it coming and going. So absolutely, this will help with that. And then all of the education and the training and the biofeedback and the things that we do in therapy are going to help us really dial in on exactly when, why, and what the cause is.
Okay, we're just pausing again because we hate to leave any
Yeah.
questions unanswered, but we don't
Yeah.
want to keep you either longer than you want to sit here with us. So we're just going to give it a little bit more time and make sure we got everybody's questions answered for now.
We did all right?
Mm-hmm.
We're going to call it?
I think.
We're going to call this at 8:30 p.m. No, I'm just kidding. Anyways, I'm sorry. Our sense of humor doesn't offend anybody, but
Yeah,
it's ridiculous.
that's it.
Okay, we're calling it, ladies. Have a great night.
Thank you
We're here
guys so
for you.
much.
Yeah, thank you. And thank you for the positive comments. And all right, let's do this.
Yep, we'll see you guys soon.
Okay, thank you.
Bye.
Bye.